All right, Lori and I believe Alma both had a question regarding sciatica. And so I spoke a little bit earlier about kyphoplasty, which again is going to be our topic this Friday at noon. I'm planning on talking about kyphoplasty. We covered this in a Facebook Live a few weeks ago. Turn off the back of the leg or the back of the leg or the sinus leg that people associate with having a pinched nerve. Sciatica can be caused by mechanical compression, or it can be caused by chemical irritation. So most people, when they think of sciatica and they think of a pinched nerve, they think of a herniated disc, big fat herniated disc, putting pressure, just like me putting a clothespin on your nerve and squeezing it. And that certainly is how many cases of sciatica, or that is certainly the cause of many cases of sciatica. But another possibility is chemical irritation, or known as chemical radiculopathy. Radiculopathy means that a nerve root is being irritated, as is the case with sciatica. And so you can have a tear in your disc, and we've talked about this, but I'll say it again. The center of your disc, which is called the nucleus pulposus, as opposed to the covering of your disc, surrounding your disc, which is called the annulus fibrosus. That center of your disc, that jelly in the jelly donut, has chemicals in it called cytokines. And cytokines are very normal. Cytokines are something that naturally occurs in your body as part of your immune system. Cytokines are, for instance, what causes fever. Interleukin 1 or IL-1 and IL-2 cause fever. And so, and there's lots of other cytokines that have other types of inflammatory jobs in your body. Well, when those inflammatory mediators or cytokines leak out of your disc and get on your nerve, they can cause the nerve to burn, if you will, to have a chemical radiculopathy, to be irritated, to be inflamed, and send pain down your leg and cause sciatica. So I think specifically what both Lori and Alma were asking is, hey, my husband, or maybe it was them as well, but I think they said their husbands, would have this intermittent sciatic pain. And why is that? Why does pain sometimes come and go? Well, it certainly can be positional. You could be bending and twisting into a certain position that makes the room for your nerve, or the space available for your nerve, minimized and compresses the nerve and causes that mechanical compression. You can also have flare-ups because you just have a high level of inflammation in your body. And those chemical mediators that can leak out of the disc through a tear in the annulus fibrosus, it's called annular tear, can cause irritation, kind of like pouring hydrochloric acid on your nerve. And as you move around, you exercise, you go out of that position that mechanically compromises your nerve, or that inflammatory state becomes less heightened. You drink some antioxidants, you exercise, you increase blood flow, whatever it takes to sort of wash away those irritative chemicals away from the site that's causing the irritation. Or your body is just kind of going through a natural cycle of having pain and not having pain. Very common for people to, quote unquote, throw their back out. I even throw my back out, once a year. And sometimes it's just bending over to pick something up. Usually I can look back and say, yeah, I sort of lifted in a way that was not, ergonomically correct, or was not, a good, healthy way. In other words, arching the low back and lifting with your quads as opposed to bending over and putting all that stress across the disc spaces in your back. So how you lift or how you maneuver certainly can have an effect on that pain, but it's very common to have these intermittent flare-ups. And generally speaking, when someone's just having occasional pain, then they can be treated conservatively. It isn't until that pain is constant, severe and constant, and basically is affecting your ability to function, that we have to get more aggressive and start doing things like shots and in some cases surgery, depending on exactly what the problem is. So again, by strengthening your core, by hydrating well, by stretching your hamstrings. I believe a couple of you, I think both of your posts, you talked about how you were told to stretch. That stretching of the hamstrings, you want to stretch all of your muscles. You want your whole body. You want to stretch all the time, especially before a workout. And even if you don't work out, with weights or whatever, if you're going to partake in a sporting activity, athletic activity, you should certainly stretch. But stretching is a very good way to help alleviate back pain. Strengthening your core to supply more or to increase the musculature around your lumbar column so that more of the load is taken up by the muscles and not purely by the bones and the discs and the facets, is also a very good idea. Hydration. I believe sauna therapy, and there's a nice 1 hour Facebook Live on sauna therapy that you can read, that you can watch, and you can read Dr. Lawrence Wilson's book on sauna therapy if you want to do that. Find it on Amazon. Sauna therapy is a great way to detox, increase blood flow to all the areas of your body. Eating foods that are anti-inflammatory, antioxidants, lots of fruits and vegetables. I think that's a very good idea. And just basically wellness in general. Spiritual wellness, relationship wellness, getting good sleep. All those things are very important and can help with sciatica. Now, obviously, if you've got a big bone spur or a disc herniation poking into your nerve, then these things may not work. And certainly if you've gotten to the point where the pressure in your nerve is so severe that you started to, say, lose strength, like I see in patients today. I saw a patient with a neck problem, and he's actually got weakness in his arm and 2 different muscle groups. He's got multiple levels that are affected. He's got a nerve test that corroborates this, and an MRI that shows he's got very severe compression, not unlike our patient that we talked about a couple of weeks ago on a Facebook Live that I showed you the live cervical surgery that I did. And he's going to require pretty immediate surgery, possibly this Thursday, but if not, for sure within the next week. He's not rapidly progressing, but he's got severe enough weakness that he needs to get to the operating room sooner than later, so he doesn't have a permanent deficit, and we have a better chance of getting a recovery in him. So the treatment for Laura and Alma, I know I'm rambling, but the treatment is hopefully non-surgical. It's hopefully activity modification and wellness. If not, then we can give shots, epidural steroid injections. I think one of you mentioned that in your post as well. That's very commonly used to take away the inflammation. If we can't get the inflammation to improve naturally, then we can get the inflammation to improve with pharmaceuticals. The good thing about epidurals is they don't have systemic side effects, or have very limited systemic side effects, because we're injecting it to a specific area. We're not giving you a pill or a shot in the butt and circulating steroids throughout your whole body, but just putting it around that nerve itself. But again, even if I tell patients all the time, when I give you an epidural steroid injection, and I do a fair amount of those, I'm not giving you a immunization against pain. It's not like I give you an epidural steroid injection and you never have pain again. It is to take the inflammation out of your nerve, break the pain cycle, because there's clear evidence that sometimes just by breaking the pain cycle, the pain will get better or go away. Sometimes that works, sometimes it doesn't. But we're giving you a period of theoretical decrease or even a period without pain altogether. That's the time to swing into action, to exercise, to go walking, to do stretching, to get active and do the things to strengthen your core, to do the things you need to get the long-term effects. The steroid injection is not fixing you long-term. It's the lifestyle changes, the exercise, the hydration, the nutrition, all those things that I've previously talked about that really give you that long-term relief. And even if you need surgery, you still need to do those things. You got lots of discs in your back. Just because one goes bad and we fix it doesn't mean that there aren't other discs in your back that can also go bad and need fixing. And the best thing you can do is to be well, to engage in a wellness program that includes exercise, hydration, rest, stretching, core strengthening, and all those things. And so I wish I had a book in front of me to show you Lori and Alma. Maybe I'll do that a little bit later when I have an opportunity and show you some pictures of exactly what the structures are that I'm talking about right now. But when you talk about your loved one, your spouse having sciatica, that's the reason that they're having it. And not getting good night's sleep can flare it up. Bending the wrong way can flare it up. Eating a lot of inflammatory foods or medications that cause inflammation can flare it up. And on the converse, things that are anti-inflammatory, meditation, sauna therapy, lots of fruits and vegetables, and all those kind of things can actually counteract that hyper-inflammation, if you will, and reverse it, reduce it, and improve that pain. Traction actually takes, when it's a mechanical compression, even when it's a chemical radiculopathy, traction allows better blood flow to the area. It can help wash away some of those irritative chemicals. Everyone's familiar with lactic acid. You go to the gym, you work out hard, especially if you haven't worked out in a while, you're sore the next day. That's not exactly a cytokine, but it's sort of similar. You're building up an inflammatory chemical in your muscle that causes you to be sore. And cytokines can do the same thing. Cytokines around a nerve can cause it to be inflamed, cause it to hurt, and mimic sciatica, or mimic a compressive. Everyone thinks of sciatica as a compressive radiculopathy, But having chemicals irritate your nerve is just as much sciatica as having a mechanical compression. It's just that you don't see anything on MRI. So everyone's like, oh, the MRI is normal. How come I have pain shooting down the back of my leg? Well, that's because there's chemicals leaking out of your disc around your nerve that you can't see on MRI that are causing your pain. Doesn't mean you don't have pain. The analogy I often use is, if I got an MRI every time somebody had a headache, 99% of those MRIs would be normal. Does that mean the patient doesn't have a headache? Of course not. So don't hang your hat too much on imaging studies like MRI. The decision or the diagnosis has to be made by looking at multiple things. Most importantly, the history, the physical exam, honestly. And then things like x-rays, MRIs, nerve tests are all other pieces of the puzzle that help kind of put the whole picture together and come up with a useful and valid diagnosis. So I hope this is helpful. Your question about sciatica. What is sciatica? What causes sciatica? How can you make sciatica better without the help of a doctor? How can you make sciatica better with the help of the doctor but without surgery? And then in extreme cases, making it better with surgery, surgical intervention. Anyway, if I didn't answer your specific question, Lori and Alma, please post on this thread and I'll try to specifically answer your question.